Accurate patient registration ensures easy patient identification compliance in healthcare, effective data management, and reporting. To register a new patient, follow these steps. Navigate to the clinical module and select Registry. On the Registry panel, fill the required fields. The mandatory fields are marked with red asterisks. Fill in the patient's surname and other names on the provided fields, as shown. Select the sex from the drop-down. Input the date of birth. You can use the date of birth field or click on the pencil icon on the right to add the age. In the ID type drop-down, choose the patient's identification type. Add the patient's identification number. If the identification type was none, you can skip the identification number field. Add the telephone number of the patient in the provided field as shown. Select the occupation of the patient. If the occupation is not on the drop-down list, click on the Add icon on the right to add the notification. For your next time selections, add the patient's residence. Residence refers to the specific place where the patient lives. Select the town of residence from the drop-down list. If the town is not on the drop-down list, click on the Add icon on the right to add the town. In the Nationality drop-down, select the nationality of the patient. As shown, add the next of kin's name. Next of kin refers to a person's closest living guardian or family members, who are identified as emergency contacts responsible for making decisions on behalf of the patient if they are unable to do so themselves. Add the relationship the patient has with the next of kin, and enter the next of kin contact or phone number in the respective provided fields as shown. To add the customer scheme, follow the following steps. Click on the customer scheme. On the customer scheme window, fill the required details as shown. In the drop-down selection, select the scheme of the patient. Input the membership number or the card number of the patient as provided by the scheme. If the patient registered is the card holder or the primary member of the scheme, check the flag is principal member. If the patient registered for treatment is not the card owner or is a secondary member of the scheme, input the principal member's name on the principal member field provided. After inputting the customer scheme, click on the plus button to save. Close the window as shown. For cash-paying patients, you do not need to add a customer scheme, as the system will add the default scheme automatically. Click on the Add button to save the patient's details successfully.